one of the great closing techniques in dentistry. People have complimented me, Mark, and I'm honored when they say they've never seen someone that gets as many yeses as I do. How do you do it? And I
want to know too.
Well,
Tell
I'm
me.
going to share my deep, dark secret. How do you get to yes 99%?
Okay, we're going to have to turn the cameras off.
Here goes.
All right.
We put up a photo of a tooth that's cracked, and I look at it and I say, wow.
And then you stop.
And that's it. And I look at them and they look at me.
And now you wait for the next person to speak.
And the next one to speak. And it's not...
And we mean that in the most optimistic
as
way.
As lovingly as we can.
Yes,
and the
yes.
patients see the color photo and they...
Sure.
What I try to say is not diagnose. And we're... God bless the men and women in dentistry. In dental school, we're taught to tell patients everything we know. What time is it? They tell you how to build a watch. I would humbly ask if you put up that color photo and point to the patient and say, do you see that black line? And just wait after you've said your wow. And the patient say, my tooth is cracked, then it's ball game.
Mm-hmm.
Then if you say, well, now let's go to Aetna and try to get a pre-denial, then I think that's a frustration because the patient's already said, my tooth is cracked. I own the problem.
Sure.
You're my doctor. How can you help me?
Sure.
That's where when you've asked these tough questions in the consult room, like, Mark, is it important to you that you keep your teeth the rest of your life? And you've said yes, then I show you've got a broken body part. Mm-hmm. And you say, well, let me think about it. That's when you can go back and say, Mark, help me understand this.
You know, I like this because, like you, I had an initial hesitation to want to go to an intraoral camera kind of situation. I felt that I was a good communicator with this hand mirror.
Right.
But you can't see squat with a hand mirror. There's no question about it. And I guess I was hesitant also because some of the stories that I'd heard, like you had heard, is this will help you get busier. And the way I heard that, and I'm not sure that anybody actually said this, I'm not sure my Patterson salesman came in, great guy, Al Root, and he didn't say buy an intraoral camera and you can take a tiny little craze line and make it look this big for a patient. No, I don't think he said that at all.
Right.
But that's what I heard. That's what I felt. I didn't want to start blowing something up to look like something more than it was. But what I'm hearing you say is, when you put that picture of that obvious thing to us, something that we've observed that they need,
right,
and we put it up on the big screen, we point it out to them and we say, wow, what you're really doing, I'm hearing you say, is I'm creating an opportunity for them to become curious.
Right.
And isn't that what we do down at the Institute in C1, is try and understand how that initial examination experience can have that co-discovery component to it. Right. You're giving that patient now the opportunity, instead of us talking and telling them what they need, I'm going to give them an opportunity to grow curious with me by saying, I love that. Wow. Could be wow good or it could be wow bad. Wow, your gums are great.
What helps is the more that you can scrunch your face up to and just go, wow. Just recoil and then stop talking, and it's amazing what happens.
I love it.
And then instead of you browbeating a patient and talking down to them, then you're partnering with them, as you use that beautiful word, co-discovery. They've learned as you've learned, changes that are going on in their body. And then you ask, how can I help you?
You know, I'm one of the luckiest guys in the world because I get to bring people like yourself, true experts in their areas, and I get to go home with all this gleaned information before I buy the series. So I get to actually come in and have all this information. Monday morning, I'll be saying, wow.
And then you can afford this tape series.
Absolutely. Absolutely.
There you go.
So what other kinds of things? What other kind of hospitality issues? You know, we do, we offer, we don't always insist, but we offer, would you like to see the rest of the office? And we walk them through on a tour. What do you do? Things like that.
If I may, let me just walk a patient through our office.
Great. That'd be perfect.
Once they've
That'd
gone
be perfect.
to our consult room
Sure.
and had our preclinical discussion, then one of the teammates will give them the tour of the office. They'll start at our Panorex, where we are 100% digital office, and they'll say, with this digital technology, it's 90% less radiation. It's healthier for you. We're very gentle with our x-ray technique. We'll take the patient, they'll go around to where they're going to get their care. They'll walk past our sterilization area, which is immaculate, hospital-grade infection control sterilization. They'll point out, here's what we've done to make sure that you're safe. They'll sit in our operatory, which we have state-of-the-art equipment, very comfortable chair. If the patients say they're a little chilly, we'll offer them a blanket from our blanket warmer.
Blanket warmer?
Yeah, we have a dryer upstairs in our office. That's our blanket warmer.
You toss a blanket in there?
We toss a blanket in there and put it in our blanket warmer and bring it down and put a warm blanket on them.
Oh, if my wife is listening now, she would like that.
Well, I love, we're always accepting new patients, so we'll take her. Then the rest of the x-rays will be taken, the necessary x-rays by our teammate. Then I'll come in. I've actually, in our new facility, have changed our new patient flow. I used to save the camera for last. Then I started thinking about it and say, what's the biggest wow? What's the biggest zap? What really is the paradigm shift for our patients? And it's when they see their teeth on TV. So as soon as they're seated and our superstar assistants have finished taking the necessary bite wing and PA x-rays, then I'll come in and I'll ask the question, Mark, have you ever seen your teeth on TV?
No, I haven't
The
really.
answer is no. It's staggering to me when I'll do my seminars. I ask for a show of hands in the audience. How many of you have an intraoral camera? And a bunch of hands go up, and I'll say,
my hand would be up.
How many of you use it every day? And about 75% of the hands drop down. And then I'll say, how many of you use it on every patient? And then about 5% or less of the hands up. And I'll say, I'll bet the 5% of you that have your hands up are among the top 5% practices in the country. Am I right? And I kind of get these sheepish looks from the people in the audience going,
wow.
So it's staggering. Again, think about that. Evidence defeats doubt. Anyway, so then I'll go right to the camera with the patient. I'll get their permission a handful of times, and some dentists have used this as a resisting fact. They'll say, well, the patients don't want to see it. And I don't believe that. As intelligent as people are and as informed as they are from the internet, I think people want to know what's going on with their body. So I'll say, particularly if someone has, I'll ask the question, why did you leave your last dentist? And if they say, well, because he's always pushing crowns, I'll say, Mark, may I ask you a question? Do you think you need one? And almost always Mark will say, I don't know. And then I'll say, well, if I see changes going on in your mouth, do I have your permission to show you what I see?
What a different kind of conversation, though, than for you to just push that crown again.
Versus you need a crown. I'm
Absolutely.
the doctor because I said so. It's, if I see changes, do I have your permission to tell you what's going on in your body? That's what you're paying for, Bubba. So I hope they appreciate that.
That's a North Carolina
privilege.
term, isn't it, Bubba?
I learned that from my Minnesota cousin, so that's good. So we'll do the tour of the mouth with the camera. We'll start with an extraoral shot of their smile, sure. Right side, left side, maxilla, mandible. And then so to me, that takes away from the single tooth issue where we show an overall appearance. Yeah. And often if they said that they talked about the color of their teeth, they're interested in tooth whitening. The #1 requested service in dentistry is tooth whitening.
Sure.
So we'll show them their smile, and they'll say, yeah, it's really yellow. And I'll say, we can say, yes, it's ugly. Or we can say, you're in luck. You got the perfect color to whiten. Why not make it a positive? You've got such beautiful yellow teeth.
Instead of, yeah, you're right, they're butt ugly.
Yeah, if we start today,
to bleach, to
if we start Monday, you'll be done before the weekend. You'll have a dramatic change if we can get it done that quickly.
And I noticed you have a very articulate manner of the words you choose. You don't say bleach teeth.
We whiten or lighten.
I love it. Because, see, I repeated back to you bleach, and I thought to myself, no, he used the word whiten. That's a better word.
I think it's a little more patient-friendly.
Have you tried, and this is just a thought that pops to me in a conversation like this, we have an easy shade in the office. VDent makes this easy shade, takes great digital shade analysis for us. We use that on the patient's teeth to show them very third-party, evidence-based as to what the color of their tooth is. And then now, it's not like me trying to hold up and me trying to match and getting someone else's opinion and walking them over to the light. Zap that tooth. You are a 3M1. For many people who are 3M1s, they can move to here, and I can show them a 1M1 or something that they can change to. And that quantifies it for them a little bit.
I love most of that. I think the 3M1 and 1M1, that's such a dental numerical thing. What I have found...
I point to this one and say this on here and that one
is
there.
Take the A4 on the Vita Shade tab and put it next to their central and zap it with the intraoral camera. And then take a B1 and put it up there and zap it. And then you've got two pictures side by side and say, which one would you like?
There you go. Fair enough.
And it's a quick way to do it in an easy way. So then we will finish doing our intraoral camera tour. We do a careful oral cancer exam. And I say to the patients very distinctly, have you ever had a dentist do that? Mark, it's embarrassing how many patients say, I've never. What are you doing? Why are you feeling under my neck? Why are you yanking on my tongue? And I'll say there are 30-some thousand cases of mouth cancer found every year. Usually it's found in 70-year-old smokers or drinkers, but it's turned up in teenagers. So if you don't mind, every time I see you for an exam, I'm going to poke and yank and make sure that you don't have mouth cancer. Is that okay?
So you use that permission statement quite often.
I do.
Good.
And they say yes. So then we do it through a very gentle periodontal
I was going to say, you do it in a very passive way, too, like, I'd like to do it. Is that okay? And, of course, they say yes.
And
it's not like you're asking something
with the cancer exam, it's kind of being an advocate softly that kind of whether you like it or not, I'm going to make sure you don't have cancer. Is that okay? No, please don't check. I'd rather have that tumor. But that's okay. So we finished the exam.
Sure.
Taken the necessary x-rays. We've done the periodontal charting. I try real hard not to diagnose on the first visit. If they say, well, what do I need? Do I need a crown? I say, that's a good question. If you don't mind, I need time to study your pictures and x-rays. Then we'll sit back down for a few minutes in private where we'll do a consultation and discuss changes that I see in your choices.
Beautiful.
And it's a lot of fun doing it that way.
That's why you get so many yeses, because what I'm hearing you say is you take the time to develop a relationship with them. You give them an opportunity to become curious and maybe move towards wanting what some of the things are that we've observed that they might need. Because sometimes we can look in a patient's mouth and in a snap second we say, you need this, 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 and this. And whether we're going to take the time to do a treatment plan properly or not, we can make some observations and probably be in the ballpark on those needs.
Right.
But we're ready.
And again,
It's about us being ready? No, it's about the patient being ready, if that's who we're trying to serve.
and again, my question back to you is, who cares what we need?
Absolutely.
Who cares what we see they need if they don't want it?
Last time I checked, that's not why they're
Yeah,
there.
can people live without teeth?
Absolutely.
Yeah, you know, they can. You know, Bill Blatchford talks about pretty much everything we do in dentistry being elective, and that offended a lot of people. Well, guess what? he was kind of right.
Yeah.
You know, except for a fulminant abscess or a broken mandible, whether someone lightens their teeth, whether they get porcelain veneers, whether they get their CRCO skid adjusted, it's kind of elective.
You're right.
So that gets back to me wanting the patients to own their problems and help partner with me as we help them choose how to get healthy.